In this video, I'm going to cover what happens in the well-child exam for the toddler period as well as the preschool period. We want to document with all of these well-child visits who is accompanying the patient. What is their relationship to the patient? We want to talk to the child at eye level, and we want to include play as much as possible. We want to allow the child to touch the equipment, and we want to explain to them what is happening with the equipment. We want to work from non-invasive to invasive and give the child choices when possible. So for the subjective information, we want to go over nutrition to see how the baby has been eating, the elimination patterns, are they stooling and voiding well, and then what their sleep patterns are like. Tantrums are common during this time frame, and the kids also like routines, so it's very important to see what their sleep regimen is like. We'll go over any parental concerns, and we'll check to see if the baby had to go to the emergency room or an urgent care visit between well-child visits, and we'll note if any medications were given. The objective data, we want to obtain the vital signs on the patient. We want to get that head circumference up until 3 years old. We want to get the height and the weight of the baby. The height and the weight for the baby needs to be every visit, and then you can go annually at 2 years of age. We can get a BMI starting at 2 years. So what are we looking for on these physical exams? So that fontanelle is going to be closing between 12 months and 18 months. We're going to look for any periorbital or eyelid edema, because that can sometimes be the first sign of nephrotic syndrome. We want to check their ears. Sometimes the tympanic membrane can be erythematous due to crying. We're going to assess the mouth. If we see any fissures, we know that that can be indicative of vitamin deficiency. We're going to check the neck and feel around for any neck masses, and the supraclavicular lymph nodes are always an ominous sign. When listening to the heart, you may encounter a murmur, and innocent murmurs are always systolic grade 1 or grade 2. The abdomen is going to still be prominent. So genitourinary, you may still encounter some labial adhesions. In the male, the phimosis may still be there up until 3 years of age. So musculoskeletal. So genu varum is bow leg. We can see this up until about 2 years of age. If it persists past that, then the toddler needs to see orthopedics. Then there's genu valgum. So this is knock knees. It can persist through preschool time, and it usually resolves by 7 years of age. When thinking about some of the developmental milestones in the toddler and the preschool age, for a comprehensive look at this, take a look at the video that I created. But for 18 months, then the baby should be using, we should encourage, and the baby should be using utensils, a spoon and a fork. A 2-year-old should be able to walk, run, go up and down stairs, kick a ball. They should be saying 2 words, and a 3-year-old should say 3 word sentences, a 4-year-old 4-word sentences, and a 5-year-old 5-word sentences. A 3-year-old should be able to draw a circle, and I like to say that they can draw one of the circles that's on their tricycle. A 4-year-old can hop on 1 foot, and a 5-year-old can skip. And they're going to be delighted to exhibit these behaviors as they progress through toddlerhood and into preschool age. Play for these children is as important as work is to adults. They're going to ask why questions. They're going to be curious. So it's very important to remind the parents to listen to them and to respond appropriately, because the kids have questions and the adults should be able to listen and provide answers. Developmental screenings during this time is going to be the Denver 2 test, the Ages and Stages questionnaire, which you can use from 4 months to 5 years. The Bailey scales of infant and toddler. You can use this up to 42 months of age. And this is the gold standard of recognizing developmental delays. You can also use the modified checklist for autism in toddlers, otherwise known as the MCHAT. Keep the hematocrit on your radar. It needs to be done between 1 year and 5 years. If a child is at risk for dyslipidemia, then you need to get a cholesterol level. Otherwise, that needs to be done at 10 years. A lead level needs to be obtained if indicated, and then the first dental screen needs to happen by 1 year of age, and then they'll go every 6 months after that, and then they'll brush their teeth twice daily. The caloric intake for toddlers and preschoolers are going to be lower than what you needed in the infant stage. The toddler needs to be weaned from the bottle when introduced to cow's milk to prevent tooth decay. The sippy cup can be introduced in infancy around 10 months of age. These kids are going to be needing 10 to 12 hours of sleep. They are craving routines, so make sure that the parents understand this and have routines in place for their toddlers and their preschoolers. Night terrors may show its face on the scene, and they happen between 2 and 4 years of age, and the child does not wake up during this time frame. So they will not remember what's happening. And then you have nightmares, and they happen about 3 to 6 years of age, and the child can remember a nightmare. So when thinking about feeding and the child being very sensory driven, they like to put things in their mouths. So we want to keep small objects, balloons away from them, and when we're feeding them, we want to avoid things like nuts and whole grapes and big chunks of hot dog, because there is a chance that the child can choke on those. We also want the child to be seated when eating, and not running around. The child may be ready for potty training coming up on their 2nd birthday, and just keep in mind that any accidents that they have around potty training should not be punished. Support them as they grow and gain more autonomy. If there's a stressful time in your life, avoid potty training in that time. Remind the parents that if they feel stressed, then the child likely feels stressed, and that's not a good time to potty train. Daytime control may be around the 2-year mark, and then nighttime control happens about 1 year later. When the child does well, make an effort to reward when the child is doing good with potty training. Children between 3 to 5 years of age are going to gain about 2.5 inches per year and about 4 pounds each year. School-age children are going to grow about 2 inches a year and gain about 6 pounds a year. Again, well child exams are a time to provide anticipatory guidance for the parents and to make sure that their child is going to be safe when they go back out into the community. So in this age group, we want to make sure that each time we're talking about car seat safety, the car seat should be rear facing according to the weight and height limits. The electrical outlets need to be child-proof. All poisons and firearms need to be out of reach. Post a poison control number. Americans have cell phones, but not really the children, not really children at this age. Have gates for stairs and barricade pools. Keep that crib at the lowest possible setting. And we've always talked about not having any bumpers in the crib. The hot water needs to be less than 120 degrees Fahrenheit. Sunscreen needs to be used, and protective clothing like long sleeves and hats when outside. Let's talk about some of the developmental conditions that affect children during this age. One is going to be stuttering. Stuttering is more common in males, and it tends to have a familial incident. So it tends to run in families. It can last from a few weeks to up to half a year, and it usually goes away on its own. So it needs to be referred out if the child is experiencing distress around it, if the child is not wanting to talk because of it, and if it persists past 6 months. A child older than 6 years needs to be referred as well. If you're noticing signs of a child on the autism spectrum where they have limited social interaction and when they have narrow focus and interest on objects or things, they need to be referred out for intervention, because intervention during this time frame is very important to optimize their quality of life. Rett syndrome is a neurodevelopmental disorder that occurs almost exclusively in female patients. After about 5 to 6 months of life, the child is going to start regressing, and skills that they previously acquired, they're going to start losing those skills. One of the first clues is that their head growth starts to slow down. That's why it's so important to get that head circumference on every visit. They may start exhibiting wringing of the hands, that movement, and then they may develop seizures. So those are some things to look out in this time frame. So that's been toddler and preschool. Hope that that's been helpful. See you in the next one.